Good afternoon, everyone, and welcome to the Leadership Checkup Series, hosted by the National Council for Behavioral Health and the Association of State and Territorial Health Officials. Thank you for joining us. Before we get started, I'd like to quickly run through a few housekeeping notes. To access audio for today's presentation, you can listen through your computer speakers by clicking Join with Computer Audio, or you can join by phone by dialing the number shown on your screen. Upon entering, you will be automatically muted. Please keep yourself muted for the duration of the webinar. We'll have time for Q&A at the end, so feel free to send your questions to the presenters using the Q&A feature at the bottom of your screen. And finally, today's webinar is being recorded and will be archived for future viewing on the National Council and ASTHO's websites. The Leadership Checkup Series is a collaboration between ASTHO and the National Council's Behavioral Health Training Institute for Public Health Officials, designed to support state, local, tribal, and territorial health officials through this unprecedented public health crisis. The goals of the Behavioral Health Training Institute are to increase the knowledge, skills, and abilities of public health practitioners and workforce to improve and enhance behavioral health strategies within public health settings. Today's presentation is the final webinar in this series, titled Mental Health First Aid, a Primer for Public Health Professionals and Communities. This is presented by Tramaine EL-Amin, Assistant Vice President for Strategic Partnerships, and Lisa Guroff, Director of Trauma-Informed Services at the National Council for Behavioral Health. Tramaine is a mental health equity advocate, providing oversight of corporate and community business development and leading strategic initiatives for mental health first aid. As a master trainer and national instructor, Tramaine has contributed to more than 2 million individuals being equipped to recognize signs and symptoms related to mental health, substance use, and suicide across the country. Lisa has over 25 years of experience in the behavioral health field, providing direct clinical services, clinical supervision, and administrative direction. She has worked in a range of clinical settings, from treatment foster care to outpatient mental health, to a variety of residential settings for children and adults. Prior to joining the National Council, Lisa was the COO of a large mental health provider, where she oversaw and directed the implementation of trauma-informed care practices across the agency. I'd like to take a quick moment to see what types of organizations are represented on today's webinar. So the poll should be popping up on your screen now, and I'll give you all a few moments to put in your answers. And I'll close the poll in 5, 4, 3, 2, and 1. Great. So it looks like we have a pretty good variety, a lot of local and state health agencies, community behavioral health. I'm seeing some primary care associations in the chat, mental health providers. Great. Well, thank you all. We're really happy that you're all joining us here today. At this point, I'd like to turn it over to Michael Frazier, CEO of ASTHO, to provide some opening remarks. Mike?
Hey, thank you so much. Buenos dias, good day, good morning, good afternoon to our friends in the Pacific that sometimes join in. It's pretty early, but half a day, good morning. It's wonderful to be with you all and to share the time together thinking about mental health first aid and really what it means for our leadership of agencies across the country. And we've just had such a wonderful experience working with the National Council and getting to know the experts on their team that it's super fitting to end off this series for now. We're hoping to do some more. We were just talking about that. But for now, with two experts, one who's been on several of these. And Lisa, thank you so much for all that you've done. And Tramaine, what a pleasure. I'm so excited to be able to say you've touched 2 million lives directly is just amazing. And I know your hands are extending that help to others too. So thank you so much for being with us. Today, we're going to review mental health first aid, which is something that I learned about a long time ago in bioterrorism preparedness and hadn't really thought about until the lineup this season. And wow, it's going to be great for folks to get a refresher and spend a little bit more time thinking about that, given the context of COVID. So we're going to review mental health first aid. We're going to talk about some virtual adaptations to that work, given that we're all still practicing social distancing and mitigation measures. We're going to talk about some evidence base for the model, and as well as implementation, and really apply mental health first aid to our lived experience right now of dealing with the global pandemic and what it means for us here in the United States across a really large, diverse, and incredibly resource-rich country. So with that, I want to make sure we save time for our experts and turn it back to you. I'm assuming, Tramaine, you're going to start us off, but if not, just feel free to correct me.
No worries there. And I'm actually going to pass it off to Lisa.
Great.
Hey. So, yeah, it has been a pleasure being with you guys. Sorry I was not able to make it to the last one, but I know you guys had some great presenters with Aaron and Amy. So what we want to do is start off the way we have started every webinar, recognizing we are in the middle of that international pandemic in the midst of complex trauma in which our bodies are constantly, without even our awareness, flooding with cortisol and adrenaline. So as we've asked our other speakers with me, Tramaine has provided us with a mindfulness breathing activity. So thank you, Tramaine. And if you guys can get comfortable, sit back. This is really to help us transition and so that we can move past that lower brain functioning and hopefully really kind of access some higher thinking as we're going through today's webinar. So please get comfortable. And Casey, if you can lead us in, thank you.
Hi, I'm Candace Alexander, Director of Health Promotions for the American Lung Association. As a health educator and yoga instructor, I'd like to offer some tools and techniques to help calm yourself during times of stress. I'll be sharing breath and awareness practices that enable you to calm and cool the nervous system, as well as promoting and enhancing clarity, serenity, and deep rest. This particular session will practice observation of the breath. All you'll need is a comfortable chair to sit in where your feet can lie comfortably flat on the floor and your back is supported. Or you can sit on the floor with your legs crossed. So let's get started. So as you sit, taking in a slightly longer than normal inhalation, and then letting it go through the mouth with a sigh. Again, breathing in gently but a little longer, letting go even more. And then taking a moment to check in with your body just to make sure that your shoulders are relaxed and your arms and hands are placed comfortably. Again, taking in a slightly longer inhalation through the nose and then letting it out through the mouth. And then once again, bringing your attention back to the rising and falling of the breath. Slowly feeling yourself beginning to rise to the surface of awareness. Stretch the body as if awakening from a restful nap. Knowing that you can return here at any time or perhaps stay longer now if you like. Thank you for joining us for this practice. If you'd like to know more, go to lung.org or call our lung helpline. Breathe easy. Namaste.
So again, just a reminder that throughout your day, it is so important that you take care of you and find those breaks. Find the time to just let your body relax, right? Do some of those mindfulness things that we've been talking about. And then the next thing we want to do is what we've done with all of our webinars is for you to set that intentionality. So this exercise comes to us from Brene Brown. So if you guys can share in the chat box what you are giving yourself permission to do. So again, this activity is really about setting your intention for the next hour with us. What do you need to do to give yourself permission so that you can fully engage in the information that Tramaine is going to be sharing with us about the mental health first aid program and all of the things that have been adjusted and that we're doing. So I see nurturing yourself, taking the time you need. As I've shared with you guys, I have kids right on the other side of my door, so giving myself permission to not be mom, to be a learner, someone's going to knit. That's awesome, right? Reading books and taking time for themselves, comfort foods, no multitasking. That's great. I can't even keep up with all of these. So it looks like just staying present. Please make sure, right, if you need to stand up or stretch or breathe, that you do that for yourself during this time. This is a time for you. So I am excited to introduce my colleague at the National Council, Tramaine, EL-Amin, and she's going to talk to us. I'm going to turn it over to you to talk to us about all the exciting things that Mental Health First Aid has been doing over the past couple months.
Yeah, absolutely. Absolutely. And continue to keep those things coming in. Thank you so much for this opportunity. Really looking forward to being with you all today. As you know, the National Council is an organization that focuses on the pillars of advocacy, policy, as well as physical and mental well-being, but specifically on that mental well-being kind of continuum is our public education arm. And Mental Health First Aid is but one program of the National Councils that focuses on making sure communities are well aware of how to connect people to the resources within the community, within the organization they might be in. And so many of you may already be familiar. So I'm so grateful for having you join us today to take time on a Thursday afternoon. It is the end of some folks' days. It's the middle or the beginning of others, as I heard some of our friends from afar are joining us. So whether it's watering your plants, thank you, Erica, whether it's not checking email, whatever you need to do to be present and to do well for yourself and give yourself permission, continue to think about those things and type them into the chat box as we get started. So as was mentioned, my name's Tramaine EL-Amin, and I've been with National Council a little under almost, actually, I think I have 26 days until I've been here for 8 years. And I'm really excited about the growth of the Mental Health First Aid program, which I've had the honor of working with during my entire tenure here. And that growth has happened because of people like you. That growth has happened because communities are realizing, public health departments are realizing, and have always known, the connection between the mind and the body exists. And it's important for us to know how to help, how to outreach, how to engage, not only when we have something going on physically, but also what are those emergent and crisis responses we should have when there's a mental health emergency. And so we definitely will share this information with you. We'll also provide an abbreviated deck for all of you as well to take away with you. And so we're looking forward to sharing some information. So first, I have a question. It'll help me guide the rest of our conversation. So on the next slide, I'd like to know how many of you have heard of Mental Health First Aid. We have a quick poll, that we will launch. And if you could just answer that poll, there's a few options there. Either, you know, you already have instructors at your department or organization. You might not have instructors of mental health first aid, but you have had courses or hosted courses within your organization or in your community. Or if maybe you don't have any mental health first aid in your health department, or you're unsure, and whether that's the health department or community, you can answer those questions as well. We'll give folks a few more seconds just to answer and close in 5, 4, 3, 2, 1. Wonderful. And if we could share those results, thank you so much, Casey. So it looks like we have about 26% of us who have instructors and are well on your way. Others have, vast majority have either heard of it or taken it in terms of having access to the course. Maybe not in your health department, and some of you are unsure. About a third of us are unsure. So that's absolutely fine. I'm excited to kind of go through this content with you, and that gives me a great sense of where folks are in their knowledge of mental health first aid. So I also have another question of you that I will ask a little bit later, but want to help you understand how mental health first aid can be utilized. As we have already stated, it's a big challenge to us that we've been presented with this year, to be flexible, and the line that is between our work and our home life has been blurred like never before. And so because of that, what I love about mental health first aid is it helps us to build that resilience from an employee standpoint, but also those skills transfer to home. And it is a skills-based training. So really excited to kind of delve into what it is and how it applies with you moving forward. So let's go to the next slide. How many of us, you can use your reactions buttons, I think, if you have them. I don't see them there. Maybe in the Q&A, in the participants, I think you have the option to use those reaction buttons. But definitely want to know how many of you have ever taken first aid. So that'll be the vast majority, right? If we were to do a show of hands, most of us have absolutely taken first aid. And so thank you for raising those hands. I see them. Absolutely, absolutely. And so when we take mental health first aid, it's similar to that in that we learn what are those key steps that we need to do to support someone in getting help, either prior to a crisis developing or as a crisis is happening in the moment. I'll often talk to folks who say, well, you know, I've never been trained in in physical first aid, but I know exactly what to do if someone's choking. I know how to call 911. I know how to get support for that person. Mental health first aid, we always when we started to grow this program, focused on the fact that we wanted it to be as common as CPR, because we don't often use our skills if we're not medical professionals of physical first aid, but we more often than not, as we go through our week at work, as we go through our week at home, we're going to encounter someone who needs the support around their emotional well-being. Asking people how they're doing is a start, but what do you do when the response to that question is not what you expected? And so what mental health first aid can do is really help us to connect the dots to services and supports where needed, but we don't teach people how to diagnose or provide treatment. Next slide, please. One of the things that was really helpful for me when learning physical first aid was knowing that mnemonic, right? The CBA or ABC mnemonic. And we identified what those areas are that we need to do first, second, third. How do we go through this process of support? And what we have is a 5-step action plan to help someone identify what to do when. And that process is algae. That algae process sounds like pond scum, but it's really not. It is a mnemonic to help you know what to do when. And as Stacy just put in the chat, thank you, Stacy, you just took the class. That's amazing. Really excited about that. And it's helping you understand when you should intervene, what to say, what not to say, how to support someone, and what resources are in my community as well as in our organization. Wonderful. Thank you, Kayla. So really excited about all of the resources that are provided in the class, but the most important thing that this is an evidence-based course. We talk about those risk factors and warning signs. We talk about information about specific disorders, but in service of identifying signs and symptoms, not in service of diagnosing someone. Just teaching people how to connect the dots and to have that warm handoff happen. So on the next slide, we can talk about exactly the impact that this has made nationally. You heard earlier the number of 2 million. We're actually at over 2.5 million people trained. And while I'm really excited about how hard Algae has been working, you see our Algae mascot there sweating a little bit. We know that the work that's been done to date is just the beginning. I don't have to convince you. I don't have to remind you either about the vast number of anxiety-provoking stimuli that we have as individuals in our communities, in our workplaces, in our homes, across our country, whether that's natural disasters, social injustice, COVID-19. So many things are layering on and piling on. And Lisa talked about complex trauma, right? And so many things are happening at the same time that we're so excited that 2.5 million have recognized and gotten that support necessary to connect the dots, but we have millions more to go. If we go next to the next slide, I'm excited to talk to you most, and what we'll spend a lot of the time doing moving forward today, about those content updates that we've done this year. You know, we know the best laid plans. We had all of our ducks in a row for a spring release of a new curriculum that we've been working on for the past 2 years. And the new curricula had completely been updated to include areas that we knew were places that we need to improve, to ensure that individuals had the supports they needed to be more culturally responsive, to ensure that the content was reflective of multiple cultures and experiences and identities. And so all of those things had been ready to go for a blended learning model, but we wound up going to fully virtual in the spring of this year. And we did so within a record 60 days of going from one business model that we've had for the last 10 years to a fully virtual experience. And so we're so excited to share that with you all. And what that looks like is people can take a 2-hour self-paced course online and then follow up in an instructor-led portion of the course, which can be delivered through a Zoom platform. And it allows someone to have less time in the in-person portion or instructor-led portion, and then have that self-paced portion prior to the course. And so what that does is it gives those skills to someone to understand how to connect those dots that we talked about, what warning signs to recognize, and we'll get into the details of that. So there's 3 delivery pathways moving forward for 3 core curricula: the adults, which is for 18 and over; the youth mental health first aid program, which is for individuals that work with young people K through 12, and then our teen program, which is new, teen mental health first aid, which is for 10th, 11th, and 12th graders themselves, and is a different format and shortened version of the course that really speaks to helping teens identify the challenges they see maybe in themselves or with their peers, and connect them to the resources and the supports that they need from a trusted adult in their circle. Right? We know that young people are way more likely to go to each other than to go to an adult. But when they know that that adult has the information necessary to support them, they're much more likely to go to them for help because they know how to maintain their friendship, even if they're taking their friend to get the services or supports that they need. So really excited about those programs, really excited that they've all been updated. And on the next slide, you'll see how we've updated those materials and what content has been updated. We've ensured that DS is talks about the DSM-5 diagnostic criteria. From a background perspective, every participant in the class receives a manual for the class or access to a manual for the digital version. We've centralized ALGE, which is the 5-step mnemonic that I talked about. We've increased those cultural considerations. We increased the amount of information that we put in on trauma. And you all, as a part of this series, have talked a lot about the impact of trauma. And so we're really excited to have that integrated into all of the content. In addition, the sections on recovery and self-care have been increased and improved to really focus on peer support more, wellness in terms of how the cycle of wellness and recovery, the impact of wellness on recovery, and how self-care and self-care supports are available for individuals in their communities, and how self-care needs to really resonate with the individual themselves. Let's go to the next slide to talk a little bit about just how much we've been able to grow this evidence base, which I'm really excited about. So mental health first aid started in Australia, actually, and we brought it to the United States in 2008. One of the things that we are excited about growing over the foreseeable future is that longitudinal evidence of mental health first aid. And one of the findings that I think has been so helpful to know about the program. It's one thing to have a program and say, well, it works, right? It's another thing to have that evidence that supports the decreased level of distance that people put between themselves and others, which gets at the stigma aspect of mental health. And so what we know is that mental health first aid increases that confidence. It's an effective strategy to promote those changes in attitudes and beliefs and promote positive impact for individuals. And we know that it increases their knowledge and improves their intent to perform mental health first aid actions. So we know that people are leaving with not only a skills-based training, but they're willing to act and willing to move forward. Next slide, please. So another thing that is really helpful to understand about the research and evidence is that from a youth perspective, and especially because of the impact that we can have, the earlier that we detect mental health challenges, the earlier we intervene, and the more likely a positive outcome. What we know is that is where a lot of schools nationally have really taken that focus. They've implemented mental health first aid in a large scale. I don't know if anybody on the call is from the California Department of Education or the Florida Department of Education. We are really excited about those two states and the growth that they've had within those school districts in implementing mental health first aid. And we know that based on some 2018 research at the University of Central Florida, that the same evidence rings true for that content as it did for the adult content. But what I like about this one the most is the second one. It's that reduction in negative attitudes toward young people with mental health concerns. So I've said a lot about the evidence. I've said a lot about the impact, but really, I also want to give you an opportunity to ask those questions. And I saw that Lisa put in the chat box, just as a reminder, feel free to post your questions in the Q&A so we can make sure we make opportunity and time to touch on those. But I'm going to also go to the next slide in the process. So Lisa, yeah, go ahead. Go ahead.
I was actually, why don't we, there are a couple logistical questions to find a trainer in your community and to determine whether it's a free training or a for cost, or whether the virtual ones are for cost. How can someone find that?
Absolutely. That is coming a little bit later. There's a slide that outlines that, but I will just give a brief response to it right now. Absolutely. So on our website, the Mental Health First Aid USA, www.mentalhealthfirstaid.org, on our website, there is a search feature where you can identify either upcoming courses or instructors in your area. Mental Health First Aid virtually has been available only just in the last, I'll say since June actually. And since June, we've trained more than 30,000 first aiders in the virtual aspect of the virtual delivery model of mental health first aid. Course pricing does vary because we don't dictate what the course price is nationally, just too many markets and differences across the country. We do give a suggested price to folks, and virtual is quite new. So if you want, and if you're looking for a virtual class and are having trouble on our website finding it, I'll give you my email address later. Feel free to reach out to me. We'll connect you to the team. And we also have the ability to just submit on our website an inquiry to find out who's teaching virtually, because that is the newest way and new delivery method. We have about 6,000 instructors who have gone through the process of registering to teach, and 4,000 who've completed that process who are actively teaching the virtual course nationally. But we can definitely connect the dots for you if you're looking to get that in the near term.
The other question that keeps coming up, Tramaine, is about the switch to completely virtual and when people might look to in-person classes and that transitioning back, or, you know, are we providing, is the National Council providing guidance? Is Mental Health First Aid USA providing guidance on that, or is that up to the instructors in the community?
Absolutely, great questions there. One of the things that we believe is that it's really important for us to have autonomy, as every community is different. We're all unique, we're all thumbprints, and every community is different in their openness in terms of where they are in their coronavirus response, where they are in terms of their state laws, their organizational policies and procedures. And so some people might continue to teach face-to-face, some folks might just be doing online. It really is an individual choice and organizational choice that needs to be made regarding when to teach. What I can say is that the newest materials that have all of the 2020 updates that are being delivered virtually are in a virtual format right now only. We do not have the newest materials and all of those 2020 updates that I outlined available for the in-person course. That was the secondary kind of push. And so we quickly got those virtual ones out. Our next step is to get the updates for the fully in-person course out, but we still do have 15,000 instructors nationally through a train the trainer model who are still delivering, who have the ability to deliver in-person courses. It's just from a National Council standpoint, we are not currently doing any in-person work ourselves. Everything that we do is virtual.
Thank you.
No problem. All right, so let's jump back into the next slide. And I'm quickly just going to touch base on some national strategic growth. To get to 2.5 million people, you have to have some really great relationships and folks who are champions in the community. And we have that at every level, whether that's federal grant programs like Project Aware or the mental health awareness training grants, whether that's regional or statewide or municipal initiatives like New York and Philadelphia, who have population-based initiatives to hit a target number of individuals, or whether that's based on sectors or partnerships like the International Association of Chiefs of Police, who have recommended mental health first aid as a part of their One Mind pledge, that 100% of sworn officers get trained in the law enforcement module that goes along with our adult curriculum. And it might even be folks like the Boys and Girls Clubs of America who are doing regional trainings right now for their clubs nationally. And then can't leave out our Born This Way Foundation partners who've helped us to bring teen mental health first aid from Australia and adapt it for our US populations. And so really excited about continuing those strategic partnerships. I have the thrill every day of being the person who supports our strategic efforts with our relationships with other communities. And I will say that communities and health departments have been the linchpin, the catalyst. They're from the outset of the growth of this program. And so it's not just been the national strategic growth, but if you go to the next slide, It's also been the growth that's happened at the county and population-based level, whether it's Montgomery County, Ohio. I saw folks from King County on earlier, so they're doing amazing work in implementation across the state as well, along with the Ohio folks. And then there's also these hospital collaboratives, whether in Texas or in Florida. There's so many people who are using innovation, aligning mental health first aid with their public health outreach goals, promodoras, as well as community health workers in the southwestern part of the state. Definitely it's just so many different ways of implementation that folks have taken mental health first aid and made it their own. And so that's what we're so excited about, and excited about that future growth. And specifically, I just want to share on the next slide a quote with you that really focuses on what it looks like from a department perspective when it comes to implementation within a public health context. And so I'll just read it really quickly. This year, we've made mental health first aid mandatory class for all of our county public health employees. We've received positive feedback about how it kind of impacts, but not just internally, externally too, as I mentioned earlier. So that line that's been blurred, we're excited to have mental health first aid as a part of unblurring that line. Let's go to the next slide to talk a little bit about where you can learn a little more. There's specific case studies. If you're looking to learn more, you can go to our website and go into filtering by industry, or you can filter by keyword. And there is a section that's specifically on case studies that talks about impact. And that is where you can find some of these case studies about the specifics that schools, law enforcement, public health, hospitals, how they've implemented mental health first aid and achieved some success and community impact. On the next few slides really focus on things that you've seen before if you've been a part of this series, but just a reminder that where we are currently is not where we've always been, and it won't be where we will always be, right? There's an opportunity for us to really apply mental health first aid to the COVID context. In fact, we've been working on a video that will be played and available for our instructors that helps orient us in understanding the impact of taking a course to better someone else's well-being, while we also need to better our own well-being. And so what we know is that those stressors exist. We know that those stressors, on the next slide, are listed on the slide, and they're things that people have been seeing and experiencing. The impact of being on a different boat. If you look at that, the everyone's in a different boat, that resonates with me. I heard this amazing quote, and I've been sharing it everywhere that I speak, in that we're all in the same storm, but everyone's in a different boat, right? And so as we're in those different boats, how things impact us, what we're doing, and how we're even taking the mental health first aid information, that's going to resonate differently with everyone. So if you go to the next slide, I just want to ask you, knowing that, to the next, there we go, to that question slide. Yes, knowing that, what are some of the self-care practices that have supported you this year? What are some of those self-care? If you could type them into the chat, what are some of those self-care practices that have supported you this year? Boxing, yes, I love it. Working out, cuddling, deep breathing, novels, meditation, journaling, long walks, painting by number. I haven't tried that one. Nail art. I've seen lots of that trending on social. Love it. Outdoors, painting, journaling, sleeping, puzzles, crochet, comedy specials. I find myself turning to comedy a lot lately as well. These are amazing. Sleep stories, grandkid time, Netflix. Love it. Binge watching shows, gardening, all the things, virtual drag shows. Yes. All the things have been wonderful here that you're listing. I love it. And I think all of these things, we can take what works for us in that moment. I think one of the opportunities we have, self-care practices that worked in April may not be working in October, right? So as you look through this list, we have an opportunity to think about what can we suggest to others that are around us that might have been working well before, but might not be working now. Things that are helpful to us, things that we might suggest to others, especially when we start to notice some of the challenges they might be experiencing, or if we're noticing that coworker or that friend. We have an opportunity and a list of things and things that have worked for others that we might suggest to ourselves or to those that we care about or work with. So on the next slide, feel free to continue dropping those in. I'm going to come back to this chat just to get some new ideas. We see that we've kind of checked all these boxes, right? We've seen this before. I love this chewing gum, right? Some of these things are very accessible, but as I mentioned earlier, it's about it resonating with the individual that is experiencing that self-care. Everybody isn't going to resonate with taking a bubble bath or chewing gum for that matter, right? Identifying those things that are unique to you and getting support. And I love that, Marianella, I love your answer about watching webinars to get CE credits. Amazing. It's amazing. And I love that you're plugged in and participative to do that. And so we know how to take care of others well. A friend of ours in the mental health first aid, one of our national trainers says, you know, we say often that we can't pour out of an empty cup, but typically we would pour out of the empty cup, but we're left with this a less, right? We're left with a deficit by continuing to support others. And so I really challenge us to think about what we can do to support ourselves as well. And one way we can do that is by utilizing some of the concepts in mental health first aid. And so I'm going to wrap this up so that we can ask more questions, have more of a dialogue about what we might do at work to kind of carry some of this forward and some of the principles that you learn when you're in mental health first aid. And so on the next slides, we will talk about one thing that someone said that made you feel supported in the workplace. If you can identify one thing. Naps, yes, naps are like, they're amazing, Karen, I agree. So what has someone said that made you feel supported in the workplace? And I'm going to have to open my chat for this one because I'm seeing some good stuff coming through. You're doing a good job. I'm here for you. I hear you. I value you. I trust you. You got this. You matter. One of your somebody's client told them, I appreciate you. I appreciate your hard work. Thank you. You're a rock star. You've missed me. You're awesome. You have a calming effect. I love that. Absolutely. You really make a difference. Absolutely. And I love these. Continue to put these in. And I encourage all of you, you know, we talk about those permissions we can give ourselves at the beginning. I hope that you can give yourself permission to imagine these things just even being said to you in this moment, that all of these apply to you, because we all are in this place of needing to hear this sometimes. So this is a great list of affirmations for us for later. So on that next slide, I think these are amazing. I think we have an opportunity to think about the context for which these things can be said. And when we think about the workplace, it's a little bit different than just our typical day-to-day. And you all, through this series, have been really honing in on what you can do to support yourselves within the workplace. And so as we close out this series, I want to make sure we're setting the context for what we know about our workplaces was true before COVID-19, and what I know will only be even more impactful after. I was speaking with someone the other day, and it was amazing to think that we don't even have to convince folks that mental wellness and well-being is important anymore. It's more so, what initiative are you going to do when, as opposed to you need to focus on this, right? So the conversation is shifting, and that's amazing. And so what we know is that with these statistics that you see in front of you, you know, almost 20% and US adults, 1 in 5 of us have a diagnosable mental health condition, and nearly 8% have a diagnosable substance use disorder. The fact that performance at work and other spaces, communication, accountability, all those things are impacted by unmet mental health needs, as well as the loss of productivity and the cost of that loss of productivity. All of those things we know. And on the next slide, we know what to look for in order to see those things reflected within the workplace. So thank you, Casey, for bringing up them all, and I'll just highlight a few of them. But what's important is when we teach mental health first aid, we not only teach what to look for, and we think awareness is great. Awareness is great, but then what? What do I do? So we're going to review some of those signs and symptoms in front of you, and it's important for us to know what to look for, because it could be pointing to something as serious as substance use or suicide. And a lot of times we don't want to ask those questions, but what we teach in mental health first aid is how to ask those difficult questions and start those conversations from a place of confidence, so that you know what to do should the answer to a question when you see someone looking hopeless or helpless, or maybe on the brink of thinking about suicide. You know how to ask that question and know what to do once the response might be yes to that question. And so we do that in a way that is a full day training, but gives a 3-year certification, just like you would get in CPR and first aid. And I think some of the immediate things that we can do to help, if you go to the next slide, Casey, would be just a few points. Tell someone, help that person to tell others what they need. What can they do to get support? What are some of those things that worked for them before? And then maybe encouraging someone to spend time somewhere in a comfortable place, right? Somewhere that resonates for them. My comfortable place might be my car and not my house, right? Depending on how I'm resourced, my comfortable place might be somewhere that's dry and safe, and maybe I don't have my own place, depending on my level of resources. And so really one of the other, exactly, Hugo says, find your happy place, absolutely. But also figuring out, how do I seek someone to support me that resonates with me in a way that I can actually receive that support and receive that help? And it's not always a trained professional, but sometimes it may be. And so in mental health first aid, we teach you how to delineate when professional help might be needed and when we might want to encourage self-help or other support strategies. The bottom line is we want to encourage those positive coping strategies, because they could be quite challenging in terms of what we might choose to go to support ourselves. So on the next slide, I just want to make sure that I leave you with a few other think about when you talk about using mental health first aid in the workplace. You just want to understand that we're all unique. So we're going to process stress differently. We want to encourage our folks to reach out. And I know you all have been doing this, and you've been encouraged through this series to make sure you're reaching out if you need it. We want to make sure that we're also not telling people what to do, but asking them what they might need, checking in with them regularly, and being present as we are in this webinar together. And I am so grateful that you are willing to share this space with me. But you want to make sure these resources that you get, whether it's in mental health first aid or resources that you've gotten through the series, are visible and accessible, because you don't want to scramble for those when you are looking for them or you need them most. I think the best thing for us to do is to model that self-care for ourselves, so that we can encourage it to others in authentic ways, and know that we are in a time of uncertainty, but we definitely can support each other by remembering the steps to do. So on the next slide, there are some resources, definitely some things that you've seen before: national lifelines, crisis text lines. And then on the next slide, there's also a few other resources. What I will say is we gave some guidance. We give guidance in mental health first aid to, if you're going to reach out to 911, ask for a CIT trained officer or someone who's a community liaison, someone who's received some extra training to support individuals who might be experiencing a behavioral health crisis. And then you also may want to search for courses, and this slide teaches you how you can do that on our website. And then the final slide is really an opportunity to see some mental health specific COVID-19 resources. And lastly, I will encourage you to figure out on the next slide some self-care strategies you can do for yourself, someone you can reach out to should you need support, and then maybe one goal you can have in the next 12 months to focus on mental wellness. So thank you for your time and attention. And I tried to give you probably what would have been 2 hours worth of information in 30 minutes. So I apologize for just talking at you, but hopefully this was helpful there. And feel free to ask us questions at this time, which I think is the next slide.
So Tramaine, yep. Tramaine, we've got a bunch of questions for you.
Okay.
I want to first share with people, there were a couple questions about using mental health first aid with our police department and the impact of that. And we actually have a response from a retired police chief that I just wanted to share, who was working in Massachusetts. And when he was the police chief, he thinks there were over 125 police departments who took the One Mind pledge.
Yeah.
People were looking for some statistics. He said that all of his officers were trained in mental health first aid. 25% of his staff were CIT, and they had embedded mental health substance use counselors, as well as jail diversion programs. And so for those who were asking a lot of those data questions, he was suggesting the Massachusetts Department of Mental Health jail diversion data for the data information. But then there were some questions for you about working. The first one here is, are there training models for childhood? So reaching children under the age of 10.
Yes, so Lisa, I'm going to answer it in a soundbite because I want to get to as many questions as possible. So we have child content in our manual for our youth mental health first aid course, right? There's resources and information about children from K to 12. We are developing a child-focused content version. We piloted it. We just didn't know COVID was coming. And so because of that, it's kind of been put back on the back burner for this moment until we get all the new content out. And then we're picking it right back up, and we'll have a mental health first aid for children and youth.
Thank you. Question about the military.
Mm-hmm.
Is this training currently available to those in the military or those in military positions overseeing military soldiers? This person's child is currently stationed where they have the highest leading rates of suicide among military soldiers, and they're recognizing what stigma of mental health is in the military population.
Absolutely. And so I neglected to mention, I apologize, as part of our adult mental health first aid course, we have 5 modules. Definitely for law enforcement, military members, veterans, and their families is one. Higher education, older adults, and then our first responders, our EMTs and firefighters. We have a version of the course for them as well. So we definitely have that. We have thousands upon thousands of military members trained, and we'll continue to offer our veterans, military members, and families trainings moving forward.
Okay, thank you. And then questions for, if you have an adult trainer, how can you access a youth trainer?
Absolutely. Same website. You can definitely get that person trained as an instructor. That is an option. This is a train the trainer model. So we have the ability to add on, if someone's trained in one modality, add it on with an additional training. But we also train folks virtually. So we have the instructor training virtually. And if folks want to take a 3-day training to learn how to deliver mental health first aid in their communities, and they're a great presenter, or have lived experience of mental health or substance use challenges in their life, and have entered into recovery and sustained recovery, we really are excited about individuals becoming instructors. And so you can be trained in one, both, or all 3 of our core programs.
Thank you. Tramaine, there are also questions from current instructors. If they've missed the deadline for their 3 classes, you know, or need to get some things updated, or even can this information be shared with current trainers? Would you be willing to put this out, it sounds like, to current provider or current instructors as well.
Absolutely. And we actually, for our current instructors, they have an extension that is, you know, as long as they need because of the impact of the pandemic. So we are not precluding them because they didn't reach their training target for the year from continuing to train. And we host regular monthly webinars just like this, specifically for our trained instructors. There's a ton of information inside of the website, and feel free to email me if you are a current instructor. If you're having some challenges, we can get you connected to the right folks.
Thank you. A language question. Will the module Spanish, rural, etc. ever be available to teach virtually or blended?
Yes, absolutely. We just finished the final version of everything that will need to be delivered and are going to do Spanish first. We do have both the youth and the adult course for youth, not the teen, but the youth mental health first aid for adults that work with youth, and the adult mental health first aid courses are both available both in English and Spanish. And so we're updating the Spanish version first, and then we'll be working toward more cultural considerations along with languages after the Spanish version is completed.
Thank you. The new program, Teen Mental Health, question about that. Can you talk about the efficacy and outcomes of the teen mental health training? Since the teen mental health training is new, and I want to make sure that what I'm learning will be a meaningful impact on the communities that I serve.
Absolutely. Teen mental health first aid actually was studied for 2 years before we brought it here in Australia, and we made those adaptations to our current context. For instance, adding things about violence and school violence, adding things about mass shootings and other kinds of mass violence, and so those kinds of content didn't exist in the curricula. We added the things that needed to be added for our cultural context in this country, but there is a wide evidence base about the efficacy and impact of teen. It is also being studied by Johns Hopkins University as we do implementation, as we've done the pilots, and we are getting amazing. Their first report was just completed. It's not released yet, but just at this point, I mean, thousands of students have helped their friends to not die by suicide as a result of taking teen mental health first aid. And I am so grateful for the existence of that program. So we'd be happy to share more when more is available, but we definitely can point you to our website that has all of the impact and studies for every single portion of the studies that we know about are on our website. There's an evidence tab, and if you go there, you can download a document that goes through all of the studies that have been completed around mental health first aid.
Tramaine, thank you so much. So we are getting a slew of questions because, you know, we use so many acronyms in our work. So for those who have been asking them, Tramaine, just so you know what we've been fielding a little, are questions about the difference between expert and mental health first aid and psychological first aid, and what were the other ones in here? CIT training.
Yes, crisis intervention training. Yeah.
Yes. So for those of you, hopefully we're trying to manage the questions as quickly as they're coming in. But as Tramaine said, yes, CIT is your crisis intervention training for police officers. SBIRT is an intervention for clinicians. Mental health first aid is for everyone. Everybody. Psychological first aid is for disaster relief. Disasters. Mm-hmm. So definitely a lot going on in the field, and I really appreciate you taking the time to talk specifically about the mental health first aid program. Mm-hmm. And for those trainers, current instructors and trainers, also so you know, there have been some questions about reaching some of the staff at Mental Health First Aid, and I've encouraged them to reach out directly to you or I, and that we will help them through email. So if we can pull up the email, I believe we have Tramaine's email at the end here, Casey. but we were not able, there are a lot of kind of trainer specific questions that are coming in as well, but we just don't have time to answer. So I want to thank everyone for joining us. This has been recorded. Oh, can we go back one more to the emails? There was one slide in between those two. But thank you guys, everyone, for joining us, especially those that have joined us for the last 6 trainings. Tramaine, thank you so much for today. And please reach out to either of us. I'm sorry we were not able to get to all of the questions. Like I said, we've been trying to answer as we've gone along. And there's some other great resources that other attendees have been sharing that are local and specific. So thank you guys so much. Thank you, Tramaine, and I hope everyone has a great day.